Hear Prime Minister Netanyahu speak now.
The coronavirus continues to hit the world. There are almost 200,000 new people infected around the globe. There are many countries where the number of cases went down, and then again it spiked for various reasons. This storm, first of all, requires victims. It jeopardizes the economy, the health, the routine of life. Some people took it lightly here, and they said that the virus is going to just disappear by itself. Well, it didn't. They said that the summer will come and the heat will liquidate the virus. But this estimation was also baseless. The summer is here, same is the virus, and unfortunately the virus is still here big time. In the last few weeks, we took various steps in order to open the economy. I relate a lot of importance to the renewal of economy here in Israel. But together with that, I kept reiterating that opening the economy is conditioned upon abiding by the instructions: masks, distance, and hygiene. I said also that it's quite reasonable that in the routine life of the virus, I compared it to playing on an accordion. According to the situation, you either open the limitations, the instructions, or you close them. This is the way to live with the virus. In Israel, as it happens in many countries in the world, we are keeping all the time to look for the balance point. On the one hand, to have less infection as possible, but on the other hand, to prevent any jeopardizing of the economy. And I know it was hurt. Many people were damaged. Many people are crying for help. And I do everything for you all the time. In the last few days, in order to ensure the livelihood of people, we prolonged the period of getting unemployment. We added a lot of money for the small businesses, and beyond this support that we started doing from the beginning of the crisis, all the allowances and the loans for businesses, all that, beyond that, I plan to talk about the next few days an economic support plan for the next 6 months. I call it an economic corona kit. It's going to give a safety net and a lot of certainty. That's the key word, a lot of certainty in employment and income. It's not that we're going to take care of you until a certain date, a close date, but to give you a whole scope of time, because you will know that you have a safety belt, a safety net for all the businesses, for the self-employed, for the regular employees during the virus. And another thing I'm going to do, I also plan to make sure that the Ministry of Finance will transfer the money to you quickly without any bureaucracy or delays. And I'm working on that also. I believe that together with joint forces, we'll be able to bring back the Israeli economy to the excellent track that it was. And moreover, at the end of the day, when we're going to get over the virus, the economy is going to thrive. And I want to reiterate again, it's in our hands. The citizens of Israel, it's in our hands. If we make sure to abide by the rules, I call them MAMI in Hebrew, the initials, mask and distance and hygiene. If we do that, we shall overcome. The key is personal responsibility and joint efforts. This is as far as the economy. And now I want to talk about the health issue. In the beginning of the week, we were with the data of 450 cases, and today we stand on almost 1,000. In the former peak in the end of March, they were 730 something, and today we reached almost 1,000. From Sunday until today, just a few days, the number of cases went up more than 100%, and the severe cases went up 50%. Some people say, well, but they're not such difficult cases. In the beginning, there weren't any, but they infect the others, and they go together with the others. There are all sorts of explanations of age, and maybe the infection going from young to the old. I'm not going to go into it, but these data are definite, are clear, and they don't leave us with any choice. We have to go back to the policy of restrictions in order to the curve to go down. Also, countries that are much bigger than us, they also do the same thing. They open and then they close. In the United States, Texas, Florida, California, Australia, where the Prime Minister spoke to me this morning, and the state of Victoria, it's 5 million people. They had to do lockdowns. We try not to do it. And I want to tell you, citizens of Israel, the easiest thing is just to leave situation as it is. Everything is open. Everybody's happy. But if we do that, we very quickly will lose control, because the pace is exponential. It's geometrical. What looks to you maybe reasonable today, tomorrow is going to become thousands and tens of thousands of cases. We should not get there. In a week's time, unless we do it, we're going to go to a peak number of cases, some severe, and I don't want to get to that number. Leadership means calling a spade, telling the truth, and this is the truth. We have to change direction now. The virus does not consider us. When it has an opportunity, it attacks. And that's why we have to do what the commander does in the battlefield. When the enemy has better stance, we cannot continue with the former plan. The battle plan has to change and to adapt itself to the enemy. Since we understand that the potential of infection derives from crowds, from people in condensed places, this evening in a special meeting that I had in the government, we decided on restrictions on crowds and events in closed places, in clubs, in weddings, up to 50 people, other places in closed places, up to 20 people. We're talking about houses as well. We know that when people come together and get together, we know what happens. People dance, they sing, and they infect one another. And then later on, the young people infect the elderly, and the elderly get infected. We need special responsibility. We're not going to change this. Same goes for workplaces and malls and hotels and tourism and transportation. All these are things that are important for the economy, because these places and these installations worked according to a special he says, according to the rules of the purple sticker that we decided on. But when talking about all these places and all these events and all these crowds, I know it's not easy. I know it's not easy for anyone, but it's in our hands. Together with that, in the last few days, there are also all sorts of people who say that Israel is an innovative country, it's a high-tech country. There is an interesting development in the struggle or the attempt to get to immunization and to vaccines. We are an innovating country, and we're all equipped for that. We have a continuous challenge, but our people and our country proved so many times in the past that they are ready for any challenge. COVID-19, for that, it's not a one-time thing. It's a strong battle. It's going to take a lot of time. But I know the great forces that we have within us. The Israeli spirit is there. It's strong. It's sound. And as we read in the Bible, and we're going to read it in the next chapter, this is a country that will rise like a lion. Together, we're going to face the challenge, and together we shall overcome. Thank you very much. Questions?
We've just heard Prime Minister Benjamin Netanyahu speaking after a meeting of the so-called coronavirus cabinet. The Prime Minister noting that the rate of new infections has risen dramatically to about 800 cases a day. Let's go back to Prime Minister Netanyahu, who's taking questions.
No other way but to go back to all these restrictions. Where is your part as a country, as a government? The tests today, they take a long time to get any answers. Can you just tell people you do your part, but the government is going to do its part? You said today in the meeting that if people continue to behave as they did up to now, you'll have to go back to what was. We are in a great battle. First of all, we want to get people back to their workplace. We want to reduce their morbidity and to save life. Just a few minutes ago, I said it's like a commander in the battlefield. He leads. It cannot be that the head of a division will say one thing and the head of the regiment will say something. Somebody will say go right, go left, and other people will say otherwise. It doesn't work that way. You decide on a line. It's never perfect, but this is the battle plan. That's what we have to do. The unity government has to produce workplaces to maintain them, to maintain the economy and life and health. This is my expectation, nothing else. This is the way it has to work, and I hope it will. Now, as for your question, one of my targets, and we spoke about it at length in the last two meetings, that I want to reduce, this is my target, to reduce the time, first of all, from locating the problem. Somebody thinks he has symptoms. First of all, the test. I said 6 hours. And the other thing I said, I want to have another target from the test to the result. In the beginning, I said 48 hours. Now I want it 24 hours. In this situation, we can get to great achievements. I want you to know that at the time, there was a target to increase the number of tests. You remember we talked about 8,000 or so, and I said it's going to get to 20,000. We're there, and it'll be more. But now the target is to improve the targeting, the follow-up, and the results, because that reduces the time that people get infected. We're doing it. Today I got data about the improvements that were made. It's a shame that the citizens don't know it, but we have a long way to go. I'm not saying otherwise. This is critical, and I hope that you all know that we don't save any effort. I'm sure that we will make the achievement. Just as we increased the number of tests, we're going to reduce the time to get the solutions and the answers. So you, the citizens, when you know that you have a problem, go test yourself. And when you get the answer, go immediately to quarantine, and then you'll help you and your family and the society in Israel. What about the enforcement? The enforcement in order to prevent the damage. Why until now you didn't even pass the law of the supervisors of people to monitor? And a second point, why don't you speak clearly and tell the people? We know that now there are things that are going to change. Why don't you have a long-term plan about, in 2 months' time, the kids have to go back to school? As for the second part, we are going to, that's exactly what I'm going to put into the economic plan, which actually is directed towards the virus. All the adaptations, it's exactly that direction. Not only do we ignore it, on the contrary, we're going to go to it directly, truthfully. And what was your first question? Remind me? The enforcement. What about but you know why I asked you again? It's an excellent question. Good that you asked it, because we asked the same thing today. Why? Because the rules, the legal rules, compel us. It's unbelievable. They compel us to go everything into to do by law, legally. What we could do in the former government, that we didn't have to pass laws. You had emergency situation. Now, all of a sudden, we have a government that said, no, but now you have the ability to legislate. So now there are all sorts of rules, how long it takes to enact a law, and all sorts of directions that we get. And the legal advisor says this and that. This evening, I convened the plenum of the government because I was told that even these decisions, and the Minister of Health is going to talk about it, we had to, not enough that the virus cabinet is going to talk about it, we need a government meeting. So we had to break, and we had to convene the ministers. It sounds comic almost. And I said, okay, now I called the ministers. Now they have to discuss. Discussion, not just to vote. And we passed the decisions. So you see that there are all sorts of barriers, but we overcome that as well. The answer is that there are bureaucracy, all sorts of rules that we have to overcome. And next week, I want to have a COVID-19 law, which will enable us to overcome all these barriers that I spoke about. What about a personal aspect to pass the responsibility to the Ministry of Defense? We heard also about all sorts of bombing in Iran. I'm not going to talk about it, of course. But what you asked about the Ministry of Defense and the Home Front, we're very happy to harness them to the activity. And I think that the Minister of Health is going to talk about it. It's very important. And we have to know how we harness the ministry. There's nothing, no personal aspect. On the contrary, I hope that all in all there'll be nothing personal. We have a huge mission. These are workplaces. It's livelihood. It's giving a safety net to people. It's not easy. It's not simple. I work around the clock. Sometimes I sleep a little bit, but I can tell you that I even think about it and dream about it. And I get up in the morning, I think about it. I consult with the ministers. I consult with the Minister of Health and the finance and all sorts of experts, economists from Israel and the world, how to reach the balance between life and economy. And I can tell you, if there's any personal, yes, this is personal. I am committed to that. Minister of Health, please. Mr. Prime Minister, citizens of Israel, as was mentioned, we are in a very worrisome surge of new cases in the virus. Almost 1,000 verified cases. We lived in some sort of an illusion that the population that gets infected is young, and why worry? People said maybe it's even good. In the last few days, we learn that in the struggle against COVID-19, there are no miracles. What we don't do, apparently, will not happen. There's a really worrisome surge in new cases, and I'll give you a very simple figure. Throughout all of June, in the excellent hospitals, we accepted 103 severe cases. In the day and a half of July, we already accepted 10 severe cases. The virus is spreading, and unfortunately, we see that also the elderly, as well as people who have former sicknesses, are infected. This is a time of emergency. It's the war of the welfare of the citizen. And the answer is that we, as the state of Israel, the people, we are much less experienced in this war than in other wars that we're used to. This answer has to be combined. There are some things that we, as a health system, have to do. For example, to stop the chain of infection. I'm very happy to say that when I came to the Ministry of Health, I found an average of some 4,000 tests a day. This policy has changed, and now we are stable for the last 3 days with more than 20,000 tests a day. This is just part of the matter. Because, as we just heard, the question also is how long does it take between the potential patient approaching, somebody thinks that he is sick, and getting the answer. We want to shorten this time. And also, as opposed to all sorts of rumors, I have to say that we do have quite a lot of achievements. It depends, of course, on the HMOs, but it's about 26 hours now between the sample and the answer. And that's not enough either. There's also epidemiological investigation, and I'm very happy that everybody knows the word now. Everybody talks about the epidemiology, everybody knows it, and I want to clarify something. The situation is not ideal. We added nurses in order to enhance the system. We recruited 280 medical students and nursing students in order to enhance the system. They work day and night. But I want to say something candidly. There is not one expert who thinks that improving this system, even if we bring 10,000 students and hundreds of more nurses, can alone give us the solution for the second wave that we are witnessing. Our mission, so that the health system will really give results at the moment, is to flatten the curve and to reduce the number of new cases, and then we have to ensure not to reach a third wave. There are things that the Prime Minister just spoke about that we are compelled by in this situation. Unfortunately, and my heart goes to the young couples and all the people with all the events, but I have to determine, as a Minister of Health, that all these parties and events and weddings in halls, they are the source of infection. We have full cities with high mobility following a certain happy occasion. And that's why there's no other way. My heart aches. But we are forced to reduce the presence in all these wedding halls, in all these event places, maximum 50 people. Same goes for clubs and for bars. We are not touching workplaces at the moment, as the Prime Minister said, not the shopping malls, not trade places, but the continuation of this policy depends on each and every one of you. I, too, I am not very happy to wear this mask on my face. It's difficult for me, too. It's difficult for everybody. I wish we could be without it, but we cannot. And wearing a mask, and distancing, and hygiene. These are simple things, and you don't have to know anything beyond it. You don't have to start reading all these small letters. These three things can help us to continue with a policy which is relatively liberal regarding the activities in the economy. Another thing that I must say. We have an asset. We don't always notice it. We take it for granted. Not in every generation in our people, even the last few generations, did we have grandpa and grandma or elderly parents. Please, let's take care of this asset. I don't think that we as a Ministry of Health have to give instructions how not to go visit your grandparents. This is the responsibility of each and every one of us, of the younger generation but also the generation of the golden age, the grandparents, our dear grandparents that I see they are being careful, but let's help them be careful, because we have to, especially those who are in old age homes, we have a special plan to take care of them. But even there, this effort has to be a joint effort by all of us. To conclude, let me say that I do not lose hope. I really wish that we get to a situation, not a corona or COVID-19 routine, but post-corona. Simple things, going on vacation with the whole family in August, maybe a possibility to hug grandpa or grandma, to walk around without the mask. If we do these things together, we as a system, we're going to improve whatever we can. The citizens, the people will behave according to expected. The enforcement will be there in order to enforce all the instructions, especially, of course, on events and all the businesses, and there especially you have to take care. If we do all that together, we will be able to prevail and to overcome this challenge. We prevailed over greater challenges in the past, and this too shall pass. Thank you.
Well, we just heard Prime Minister Benjamin Netanyahu and Health Minister Yuli Edlelstein address this surge. Some call it a second wave, a rise in the cases of coronavirus. Now, as Prime Minister Netanyahu said, seems to be peaking at around 800 new cases a day. As a result, the government introducing new measures. As of today, they are going to be limiting gatherings at places such as bars, weddings, clubs, basically commercial businesses that have crowds. That is now going to be limited to 50 people. Of course,